IVF or in vitro fertilization, also sometimes called as a test tube baby, generally refers to a process in which the fertilization of the egg is done with the sperms outside the body in a specialized environment, that is an embryology lab. So basically IVF is a very specialized technique in which we are placing the egg outside in a petri dish, and then we are fertilizing it with the sperm in the embryology lab. This is also literally means in glass. That is why it has also been called as test tube baby, wherein the fertilization is actually happening in a petri dish and not a test tube. The candidates for IVF can be anyone, in the sense that from starting from couples with unexplained infertility to couples with tubal block infertility, couples with anovulation or PCOS like infertility, or couples with mild male factor infertility, or anyone who's just having a difficulty in conception are candidates for IVF. It requires around 2 to 3 weeks time to complete one cycle of IVF, because in IVF our intention is to first stimulate the lady's ovaries to produce multiple eggs. So we require to give them hormones in the form of injections, which are given starting from the second day and given on a daily basis to her, and then the woman undergoes regular ultrasounds to see how she is responding to those hormones in terms of egg growth and numbers. So once we see that the number of eggs that are growing is optimum, as well as the size has reached a level of maturity, we trigger these eggs to mature by another injection, and after a specific time of giving this final maturational injection, we take these women to the operation theatre, wherein under short anesthesia and a gentle procedure the eggs are aspirated out. The process of aspiration of these eggs is a simple one. There is generally no cut on the body of the woman, and we attach a small needle on the same ultrasound that is being used to monitor their egg growth, and then with negative pressure we puncture the follicles that contain the egg, and the fluid is sucked out. Along with this fluid, the egg that is contained inside the follicle is also sucked out, and this fluid is then passed to a specialized person, that is an embryologist, who would study this fluid under a microscope in the lab and then separate the eggs from the fluid and keep them in the incubator. After some time, once the husband has given the sperm sample, we wash the sperm sample, and then the sperms are selected, and on every egg around 50,000 to 1 lakh sperms are placed in the petri dish, and then the eggs are incubated in a special culture medium which will give it the nutrition to grow and divide, and then in the incubator they are kept for like 2 days, 3 days, and allowed to grow and divide. The fertilized eggs, which will be called as embryos, are studied on a daily basis to assess not only their fertilization and growth but also their quality. And then after an appropriate time of 2 to 5 days, whichever is considered right, which has been discussed by the doctor and the embryologist, we select the best quality embryos up to a maximum of 3, and then load them in a fine catheter, and then they are gently passed inside the woman's womb and are placed there under the ultrasound guidance. So this is basically an IVF procedure and will be taking at least 15 days to get complete one cycle. After this, there is a 2-week wait time wherein we wait for the embryos to implant and then do a pregnancy test, which is generally done in the form of a blood, that is called as serum beta HCG, and then after that we get to know if IVF has been successful and the woman is pregnant or not.